lot of fat and connective tissue. So just maybe, and then this here, just for the record real quick, is a little more extensive. You see it's a whole it's largely a urinary system. You see the two kidneys here, some of the major blood vessels. Down here's the bladder and the prostate. This is from a male. And we'll get to that. You know, this is a male urinary system with some reproductive structures as well. And we'll get to that shortly. Looking at these two kidneys, you know, first of all, on the outside, this one shows a little bit. By the way, we are on Roman numeral number 2. This is the human kidney. So Roman numeral number 2, human kidney, along with the kidney model and the sheep kidney. I've got the sheep kidneys over there. That's what you'll be doing next, right after we're done here. So on this specimen, there's a little bit of the renal capsule that we saw on the slide. So this is the outer membrane. You can kind of see a little of it here. Most of it's been removed. Maybe you see this membrane on the outside. It's sticking. So this is the renal, not a lot of it, but at least we got some renal capsule. It's on the blue sheet there. Okay, so renal capsule. Maybe the best view of it is that's kind of what I'm holding there, that outer membrane. Okay. There's no other renal capsules, so I think that's the main reason why I had that specimen. If you look at this kidney, the renal capsule's been removed. There might be like a little of it right there. You can kind of see some of that membrane, but it's just the outside membrane. Now let's look at the kidney. First put it together. There's the adrenal gland, by the way. So there's the adrenal gland, which would sit on top of the kidney, but we're not worried about the adrenal gland. So first of all, the hilum of the kidney is this concave area here where the blood vessels are connected and the ureter. Okay, so this is the hilum. It's just more of an anatomical landmark of the kidney, you know, that concave region. Concave region. Now, when we look at these, let's get the adrenal gland out of the way, just so it's not dangling in our way. Does anybody know the name of this long tubule coming out of the kidney? Everything comes in and out at the hilum. Okay, what's that long tubule called? Any guesses?
Ureter.
That's the ureter. Okay, so yes, that's where the urine would leave the kidney. Now you see these two blood vessels there. Okay, anyone know what their names are? Just the two of them?
Renal artery, renal vein.
Renal artery and renal vein. And you know what the next question's going to be? Which one's which?
Yeah.
Mm-hmm. Can you tell your arteries from your veins? It's pretty clear. It's pretty clear to me which one would be. You can either look at the shape of it, the size of it.
Whether it's squishy or hard. Whether it has
This one is the vein.
Vein?
Vein. Yeah, its veins are usually bigger, and look at the arteries, very firm. If you were to squeeze it, you could tell that artery is very firm and round. And also veins, when the vein is always or typically bigger than its arterial counterpart. More blood, you might remember, more blood's always in the venous system than the arterial system. And it's not super clear, but also veins have thinner walls. And this, if you look close enough, it does have a thinner wall. And then that would be the artery. So renal artery here, renal vein there, and the ureter. And the renal capsule.